Good morning, Tyler. I'm Mihiraa. Let's start the warm-up session. Can you describe a situation where you had to address a patient's noncompliance with their treatment plan? How did you approach this challenge?
I encountered a patient who was struggling with non-compliance with their prescribed treatment regimen due to various personal and logistical barriers. To address this challenge, I took a patient-centered approach, engaging in open and non-judgmental communication to understand the underlying reasons for their non-compliance. Together, we identified specific barriers and collaboratively developed a modified treatment plan that was more manageable and aligned with the patient's needs and circumstances. I also provided ongoing education and support, empowering the patient to take an active role in their care and promoting adherence to the treatment plan. Through this approach, we were able to overcome barriers to compliance and achieve positive outcomes for the patient.
Can you share an experience where you had to collaborate with interdisciplinary teams to deliver comprehensive patient care?
Certainly. In a previous role, I cared for a patient with complex medical needs requiring input from various specialties. I initiated regular interdisciplinary meetings involving physicians, specialists, therapists, and other healthcare professionals to develop a cohesive care plan tailored to the patient's unique needs. Through open communication and collaboration, we were able to address all aspects of the patient's care effectively, resulting in improved outcomes and patient satisfaction.
Can you provide an example of a time when you had to advocate for a patient's needs in a challenging environment?
In one instance, I encountered a patient whose treatment plan wasn't being adequately followed due to logistical issues within the healthcare facility. Recognizing the importance of consistency in their care, I worked closely with the interdisciplinary team to streamline processes and ensure that the patient received the necessary interventions promptly. By advocating for their needs and facilitating communication among team members, we were able to improve the patient's outcomes significantly.
Describe a time when you had to adapt to a sudden change or unexpected situation in your nursing role.
Adaptability is a crucial skill in nursing, and I've encountered several instances where I've had to quickly adjust to unexpected changes. For example, during a shift, a sudden influx of patients necessitated reallocating resources and prioritizing care based on acuity levels. I remained calm under pressure, collaborated with colleagues to redistribute workload effectively, and ensured that patient needs were addressed promptly and efficiently.
How do you prioritize competing demands and tasks in a fast-paced clinical environment?
Prioritization is essential in nursing, especially in fast-paced settings. I employ a systematic approach, assessing the urgency and importance of each task and allocating resources accordingly. I communicate openly with colleagues to coordinate care and support each other in managing workload effectively. Additionally, I continuously reassess priorities and adjust as needed to ensure that patient safety and quality of care remain the top priorities.
You can now start the role play.
Good morning, Mihiraa. I'm Nurse Tyler Connick. How are you feeling today?
Good morning, Nurse Tyler. I'm feeling a bit anxious, to be honest. I've been diagnosed with psoriasis recently, and I'm not sure what to expect.
I understand, Mihiraa. It's natural to feel that way. Feeling anxious about your diagnosis is completely normal. Dealing with psoriasis can be overwhelming at first, but please know that we're here to help you through it. Today, my goal is to give you a clear understanding of psoriasis, and address any worries or questions you may have. Let's begin by talking about what psoriasis is, and how it impacts the body.
Thank you, Nurse Tyler. Can you explain what exactly psoriasis is?
Certainly, Mihiraa. Psoriasis is a chronic autoimmune condition, which means that your immune system mistakenly attacks healthy skin cells. This leads to a rapid buildup of skin cells, resulting in red, inflamed patches covered with silvery scales. These patches can appear anywhere on the body, but they're commonly found on areas like the scalp, elbows, knees, and lower back. Mihiraa, one thing to keep in mind is that psoriasis symptoms can vary greatly from person to person. Some people may only have mild symptoms that come and go, while others might experience more severe and persistent symptoms. This condition can have a significant impact on your daily life, affecting activities, self-esteem, and even relationships. Unfortunately, there's no cure for psoriasis, but don't worry, there are treatment options available to help manage the symptoms and improve your quality of life.
Yes, I indeed have some of these symptoms. Well, what treatment options are available for psoriasis?
Mihiraa, there are various treatment options available to consider. We can explore topical treatments like creams and ointments, which are applied directly to the affected areas of the skin. Another option is phototherapy, where your skin is exposed to ultraviolet light under controlled conditions. Additionally, there are systemic medications, which are taken orally or administered through injections. These medications work to regulate the immune system's response throughout your body, helping to manage the overactivity that contributes to psoriasis symptoms. We'll discuss each option in detail and decide together which approach is best suited to your needs and preferences. Mihiraa, do you have any questions or concerns?
That's helpful to know. Well, are there any lifestyle changes I can make to manage my psoriasis?
Definitely, Mihiraa. Making changes in your daily habits and lifestyle can have a big impact on managing your psoriasis effectively. Avoiding things that trigger flare-ups, like stress, smoking, and specific foods, can help keep your symptoms under control. It's also important to focus on maintaining a balanced and nutritious diet, staying hydrated, and finding ways to manage stress, whether through relaxation techniques or mindfulness practices. These adjustments can all contribute to improving your overall well-being and reducing the frequency and severity of psoriasis flare-ups.
Thank you for the advice, Nurse Tyler. I'm worried about how psoriasis will affect my daily life and relationships.
Mihiraa, it's completely understandable to feel worried about how psoriasis will impact your daily life and relationships. It's a condition that can bring about significant changes and challenges. But I want you to know that you're not alone in facing this. Many individuals with psoriasis lead fulfilling lives with the right support and management strategies in place. Remember, we're here to support you every step of the way. Together, we'll work towards finding the best ways to manage your condition and ensure that it doesn't define or limit you in any way. You have a whole team here dedicated to helping you navigate through this journey.
Thank you, Nurse Tyler. I appreciate your reassurance and guidance.
Mihiraa, before we wrap up, let's take a moment to summarize our discussion today. We've covered a lot of ground, including what psoriasis is and how it impacts the body. We've also explored various treatment options, including topical treatments, phototherapy, and systemic medications. Additionally, we highlighted the importance of lifestyle changes in managing psoriasis symptoms, such as avoiding triggers and maintaining a healthy lifestyle. I want to emphasize that managing psoriasis is indeed a journey, but it's one that many people navigate successfully with the right support and strategies in place. Our goal is to ensure that psoriasis doesn't define or limit you, and we're committed to helping you every step of the way. If you ever have any further questions or concerns, please don't hesitate to reach out. We're here for you.
Thank you, nurse.